Chloe, do you give permission to be in my video?
Yep.
360. Okay, first thing I'm going to do, I'm going to go ahead, I'm going to log into my EMR. I'm going to go to the patient list. I'm going to select my patient. In this case, it is Michael Ed. I am going to go to the to-do list, and then I am going to see what is to do at this time at 1100 hours. And it is 1100 hours right now, or 11 a.m. I'm going to look at his medication list. I'm going to look through, and I can see he has lisinopril, furosemide, digoxin, and metoprolol, all due. I'm going to be administering the metoprolol. Again, it is the correct time. His allergies are sulfa. So, since the medications are due, I can check his vital signs if I was going to administer these to make sure that the BP isn't already too low and to make sure that the heart rate isn't below 60. So for the metoprolol, I am okay to go ahead and administer this. So I'm going to log into my AccuDose. I logged in. I'm going to go select my patient. I'm going to go to his medication list. I'm going to select the metoprolol. And now I'm going to go ahead and just verify the 6 patient rights and make sure that I have the correct medication. So I'm going to start with that I have the correct patient. So I can compare the AccuDose with the EMR. Michael Ed on both is the same. The MRN number is the same on both. Date of birth, 4/24/1944, is the same on AccuDose and EMR as well. I'm going to check that it's the correct medication, the metoprolol. So it is the medication I need. 50 milligram dose, and this is a 100 milligram tab. So this is the correct tab that I will need, the correct dose. The route is oral, and this is an oral tab, so that is correct. The time, 1100 hours, and the date, the correct date as well. And it is the correct time. So that all checks out. Documentation will come after I administer the medication to the patient. So now that I've reviewed the 6 rights, I can go ahead and open the drawer and get my medication. So I will get the metoprolol. I'll verify that it is the correct metoprolol. It is the 100 milligram tab. And the expiration date is good. And the package is intact. There's no tears, and it hasn't been opened before. So I can go ahead and use this. Next thing I'm going to do, I'm going to log out of my EMR. And I'm also going to log out of my AccuDose, and this is HIPAA. This is the Protect Patient Rights, and this is going to prevent people from using my name or my license in the EMR or the AccuDose. Next, I'm going to gather supplies I need. So I'm going to have my medication cup, and I'm going to have my pills for the patient, and I also grab some water for the patient too. Now, next thing I'm going to do is I'm going to select the correct patient room, and my patient is Michael Ed, so I will be sure that I do have the correct room. As I enter the room, I'm going to wash my hands, and I'm going to apply gloves because I'm going to have to split my pill, or I'm going to have to split this medication in half. So I will be touching the medication. My name is Eric Thompson. I'm a nurse at the University of Toledo. I'm going to be administering the metoprolol. Okay, and this medication is used for to lower your blood pressure and to decrease any tachyarrhythmias you may have, and it is also to aid your congestive heart failure. What is your name?
Michael Ed.
And what is your date of birth?
4/24/1944.
Okay, and I can check your allergy. It is sulfa. So I'll cross-check that just to be sure before I do administer medication. So next thing I'm going to do, I'm going to go ahead and log into the EMR, which I've done. I logged in. I'm going to go to the MedRx section, and I'm going to go to or I'm going to log into my EMR. I'm then going to scan my patient's bracelet. So I went ahead and scanned it, and it's going to bring up her profile. I'm going to go to the Med RX, and then I'm going to go to administer medication. Okay, now that I'm there, I can go ahead and scan my medication. So I scan my medication. And now it's going to ask me if I need to make any changes to the dose. I have to split my pill in half, so I'm going to go ahead and open my package. I'm going to go ahead and put it on the pill splitter. And then I'm going to split my pill in half. Okay, and then I'm going to I'm going to throw away in the appropriate container the other half of this medication. I'm going to put this half into the medication cup for my patient. I'm then going to document that I'm giving only 50 milligrams of that 100 milligram dose to the patient. So next, I'm going to scan my patient's ID, again, her badge. I'm going to scan it before I give it to her. Again, I'll cross-check the allergies just to make sure one more time. And before I administer, I'm going to make sure I'm going to do the 6 rights one more time. So I can go ahead and look at the EMR. I can check her bracelet. It's the correct patient. Birth date is the same. And then I can check the medication. I can look at the wrapper. Okay, it is metoprolol. It is the correct med. The dosage, I split it. It is 50 milligrams. It is oral. It's going to be by mouth. This is what I need. And then I'll also check the correct time. It is now 11:10 hours, and it was the time due is 1100, so I am within that hour. And so I will now administer medication to my patient. I will watch the patient. I'll make sure that she does swallow the pill, and she has, or he has. So now, next, I'm going to go back to my EMR. I'm going to document any medications that were not taken. I'm also going to document the time that I administered the medication. I'm just going to make sure that everything is verified. I'm then going to scan my badge. And then one last time, I'm going to go ahead and review that I have the correct documentation, and then at the correct time and date, I administer it correctly, and it's all documented. I'm going to make sure everything is saved. So I'll save it. And then I'll go ahead and log out of the EMR. And then I will begin by closing with the patient. I will make sure that the patient is comfortable. I will put the side rails up ×2. I'll put the bed in the lowest position. I'll make sure that he has the call light. And I will also make sure that he has any belongings for himself.